So that's so a specific recommendation, if you like, as opposed to be. I think the previous language was more permissive. So I think just to rewind a little bit, the chief medical officer's position from the start was that, of course, these masks protect others. So if you're wearing it, you're protecting other people against your droplets. So at the start, it was obviously someone who is sick, who's coughing or sneezing. If they're going to go out or have to go to a medical appointment, for example, they need to cover the cough and with facial covering or mask. That is for the sick person. So it's when we got more evidence about asymptomatic and pre-symptomatic individuals, and that although we don't fully understand their role in transmission, it is an added layer of protection, even for people who don't have symptoms, to wear a mask to prevent transmission to others. And even though the evidence base hasn't changed too much, and particularly as people have generally been staying at home, and now that we're sort of reopening or restarting a lot of the activities, the chief medical officers felt that they can recommend this for people who cannot maintain that 2-meter distance. And more specifically, of course, if there's virus in your, there's been community transmission in your jurisdiction. And as Dr. News said, jurisdictions felt that they need to do that risk assessment because there's some provinces and territories that haven't had community transmission, and others who have clearly have and continue to have community transmission activities. So they will do their individual risk assessments in terms of the very specific recommendations locally. But I think that, from our perspective, it is an added layer of protection. It is for you to protect others. So if 2 people are wearing masks, I'm protecting you and you're protecting me. And so I think as more people do go out in the community, you can imagine there'll be more people on public transport, or maybe more people. Some of the retail stores are beginning to open, for example. And if you can't predict whether you can maintain that 2-meter distance, then it's recommended that you wear the non-medical mask or facial covering.